Hello everyone, welcome back to my YouTube channel. Today I'm going to discuss about carotid triangle, which is one of the triangle included in anterior triangle of the neck. From my previous video, I discussed about the posterior triangle of the neck. So now I'm going to discuss about the carotid triangle. Here you can see the anterior triangle of the neck here. This is the anterior triangle of the neck. So this anterior triangle of the neck is divided into uh, four another subtypes as the submental triangle here and the submandibular triangle, then carotid triangle and muscular triangle. This is the hyoid bone. So in some books says this region as suprahyoid region and this region as infrahyoid region as well. So in the suprahyoid region we can see submental triangle and the submandibular triangle, and in the infrahyoid region we can see the muscular triangle and the carotid triangle. When we talk about the carotid triangle, it is so called because of all three carotid arteries. That means common carotid artery, external carotid artery and internal carotid artery are present inside this triangle. And also those carotid arteries are very superficial in this triangle. Let's see what are the boundaries of the carotid triangle. The carotid triangle represents three boundaries as anterosuperior and anteroinferior, and finally posterior. Anterosuperior boundary, anteroinferior boundary and posterior boundary. And there is a floor as well as a roof. Anterosuperior boundary is formed by posterior belly of digastric. I'll show you in a separate picture. In this picture, you can see the posterior belly of digastric here. This is the posterior belly of digastric and the stylohyoid muscle. These two muscles form anterosuperior boundary of the carotid triangle. Then anteroinferior boundary is formed by superior belly of omohyoid muscle. This is the superior belly of omohyoid muscle. Then the posterior boundary is formed by the anterior margin of the sternocleidomastoid muscle. Then the floor, it consists of four muscles: hyoglossus muscle and thyrohyoid muscle anteriorly. This is the thyrohyoid muscle. Here you cannot see hyoglossus muscle. This is the thyrohyoid muscle. Then you have inferior constrictor muscle and middle constrictor muscle posteriorly. This is the floor of the carotid triangle. Anteriorly thyrohyoid and hyoglossus muscles, posteriorly inferior constrictor and middle constrictor muscle. Then the roof of the carotid triangle consists of skin, then the superficial fascia with platysma muscle, and then intestine layer of the deep fascia of the neck. Let's see what are the contents of the common carotid, what are the contents of the carotid triangle. Here you can see this is the common carotid artery, and here this is the bifurcation of the common carotid artery, and it is divided into two as external carotid artery and internal carotid artery. So the bifurcation of the common carotid artery takes place at the level of upper margin of the thyroid cartilage. The internal carotid artery is posterolateral to the external carotid artery in this triangle. Those carotid arteries and internal jugular vein are inside the carotid sheath. Those are inside a carotid sheath. I talked about the carotid sheath in my previous video on posterior triangle of the neck, and also in the fascial layers of the neck. Then the external carotid artery gives branches here in this triangle. Then here you can see a swelling like structure. It is the carotid sinus. So carotid sinus is a localized dilatation of common carotid artery and adjacent internal carotid artery. This carotid sinus is supplied by sinus branch of the glossopharyngeal nerve. This is the sinus branch of the glossopharyngeal nerve. It is a baroreceptor for controlling intracranial blood pressure. The carotid body is a small neurovascular structure situated close to posterior wall of the carotid sinus. Then you have internal jugular vein. It passes through the carotid sheath, lying lateral position compared to the common carotid artery and in the internal carotid arteries. This internal jugular vein also receives tributaries corresponds to the branches of the external carotid artery in this area. Then you have the vagus nerve. This is the vagus nerve. Vagus nerve passes vertically downwards in posterior position inside the carotid sheath. It gives superior laryngeal nerve which divides into internal and external laryngeal nerves here. Then you have the spinal accessory nerve which crosses the superolateral angle of the carotid triangle to enter the sternocleidomastoid muscle. Here you can see hypoglossal nerve, which is the 12th cranial nerve. So it enters the carotid triangle deep to the posterior belly of digastric between internal jugular vein and internal carotid artery. You can see very clearly this is the internal carotid artery and this is the internal jugular vein. So it enters in between this internal carotid artery and internal jugular vein. It crosses superficial to internal carotid artery, external carotid artery, and the loop of lingual artery from lateral to medial side. Here, the nerve gives off superior root of ansa cervicalis and a branch to thyrohyoid muscle. The ansa cervicalis is formed in the anterior wall of the carotid sheath. The cervical sympathetic chain extends vertically posterior to the carotid sheath in front of the prevertebral fascia. Here in this picture you can see this is the jugular digastric node. This is the jugular omohyoid node. You can see the lymphatic nodes and network of lymphatic vessels here around the internal jugular vein. So these two nodes are very important. This jugular digastric node and jugular omohyoid node. So remember that these two nodes are also a content of carotid triangle. The clinical aspect of the carotid triangle is we can feel pulsations of carotid arteries here in this triangle. Here there are 3 carotid arteries and 5 branches of external carotid artery. So there is a massive arterial pulsation felt here when palpating with the fingers by keeping fingers in the carotid triangle. So the carotid pulse is palpable just lateral to the upper margin of the thyroid cartilage. So that's all about carotid triangle. Thank you for watching.